Doctor, we have a question from Mr. Gurdeep Shaw, once again on the RT-PCR test. He says, his question is, does the RT-PCR test only detect COVID-19 infection, or does it show other viral infections also? This is because there are murmurs that the RT-PCR is not very accurate and it shows positive even if it's a regular viral infection.
No. So I must tell Sudeep that that's very rare, very, very rare. RT-PCR for COVID-19, the false positivity rate is extremely low. And therefore, when it's extremely low, and when I talk in the regions of less than 1%, I think we shouldn't go by that very occasional report we hear of someone testing positive and it was in COVID. I would still believe it's COVID. If he didn't have symptoms, great. Just quarantine for 10 days. I mean, nothing major is lost, for that quarantine. Okay. Having said that, the false negative is what we are worried about. And RT-PCR doesn't pick up other viral infections. I mean, it's a PCR for the genetic sequence of COVID-19. So false positives for other viral infection are not going to happen. The false negative rate is somewhere between 20 to 30%. And though it said 30%, I think it's closer to 20%. If the swab is collected well, transported quickly, I think you have a good yield. Even you get a lower false negativity rate. So the false negatives are what we're worried about. When you highly suspect COVID, do another swab. And if 2 swabs are negative, maybe, and you still suspect COVID, maybe do a scan. That is probably an indication for a CT scan. So 2 swabs negative, go and do a scan. And I think those are some things I think we probably messed up in Mumbai, where someone said that, if you have a positive swab, you'll get a free scan somewhere last year at BKC. That means everyone with a positive swab is coming for a free CT scan. You can imagine the chaos there. I think they've changed that rule. I hope so. But it's actually people with 2 negative swabs, high suspicion, get a scan done.